Hi, in this video we'd like to discuss the topic of PCOS and ectopic pregnancies. So ectopic pregnancy is a condition where your pregnancy is now situated outside of the uterus. Normally, embryo will be implanted on the endometrium. This is the most optimal location for it to implant itself and see a full-term healthy pregnancy with no complications. However, ectopic pregnancies mean that this embryo is not implanted there, but implanted elsewhere. But the most common one that we see is a tubal pregnancy, which means during the delivery of the embryo, it's accidentally implanted itself in the fallopian tube. And this can cause some complications as well, potentially life-threatening as well, because let's say an embryo does implant in the fallopian tube. If it's not properly diagnosed, managed in time, as the embryo starts to grow into a fetus, the fallopian tube will rupture and it can cause a massive internal hemorrhage, massive internal bleeding, and potentially threaten the mother's life as well. So we need to do quick management of that. So to avoid an ectopic pregnancy, because it is a serious medical emergency, we need to do proper prevention. And PCOS can actually lead to ectopic pregnancy. Now let's discuss how that happens. So because PCOS is a condition that can develop its other underlying complications as well at the same time, because PCOS happens during embryogenesis, where your ovarian tissue has some remaining testicular tissue. That is why you're actually born with this congenital condition and you experience high testosterone compared to your normal female counterparts. High testosterone leads to much more aggressive behavior, a higher sex drive, and all the physical symptoms that we see with PCOS. For example, there's the acne on your face and your body, there's excessive body hair, the dark and also thick skin as well, several other complications, obesity as well. All are related to the presence of this abnormal tissue causing high testosterone. So how it causes ectopic pregnancy is that not only is it an ovulation problem, because PCOS will cause oligomenorrhea. You're not going to ovulate every month. It's an irregular menses, so it will cause some problems in getting pregnant. So patients who have PCOS, they might suffer from infertility. However, there are patients who can get pregnant with PCOS, but there's a risk that it will end in a miscarriage. It will lead to an ectopic pregnancy because PCOS usually comes with another underlying complication. Almost 50% of these patients will have PCOS with another condition of the uterus or the fallopian tubes. So the first one is that they have some form of a disorder of the fallopian tube. Now it can be either a fatty fallopian tube, which means this fallopian tube carries high amounts of fats, which will obstruct the delivery of a egg cell or the zygote, causing implantation to happen on the fallopian tube. Ectopic pregnancy cause number one. Secondly is a naive uterus or a septate uterus. These uterine malformations are very commonly associated with PCOS. Usually if a patient has PCOS, they will have either a fallopian tube disorder or a uterine malformation of sorts. So how a septate and naive uterus causes a ectopic pregnancy is that, let's say if you do have PCOS and miraculously your egg cell is managed to successfully fuse itself with a sperm cell and a zygote forms. Let's say it does successfully flow from the fallopian tube into the uterine cavity. If it encounters a septate or a naive uterus because of the tissue composition and the structural differences compared to a healthy pear-shaped uterus, it will easily flow from this end of the fallopian tube into the opening, into the opposite end of the fallopian tube, because it's trying to find a proper place to implant and it cannot find. And because of the septate, it can easily bring it to implant into the opposite fallopian tube. This is a very common occurrence. And if you don't manage it properly beforehand, this patient can very well lose one of a fallopian tube. That's because management for ectopic pregnancy is to terminate the pregnancy and to remove the fallopian tube. And if it happens another time again, this patient will lose another fallopian tube, and you only have two fallopian tubes. At that point, something that's relatively easy to treat has become something that's caused absolute infertility. That's the worst case scenario. This patient can no longer get pregnant on her own. She will need IVF or IUI to assist on her pregnancy journey, and we want to avoid that. That is why at Antai Hospital we put emphasis on your first diagnosis. We need to do proper full systemic diagnosis. Not only do we want to diagnose your PCOS, we want to know whether or not there's a fallopian tube disorder, whether or not there's a uterine malformation, because we want to treat all three conditions if they are present. Now, it's not to say that all patients will have all three. Some patients only have PCOS, but the point is that we need to put an emphasis on a systemic diagnosis, and then we need to use the proper equipment, for example, laparoscopic diagnosis, where the doctor can physically look at the fallopian tube, whether or not there's some deformity, some obstruction, presence of excessive fatty tissue, duplication of fallopian tubes. All of this can be diagnosed beforehand, before pregnancy. For naive uterus and septate uterus, how we diagnose is that we will use HSG, hysterosalpingograph, to diagnose beforehand so that we can accurately assess the shape and size of the uterus. So all of these ectopic pregnancies and the fallopian tube removal can be avoided. So at Antai Hospital, what we offer you is that we will do a PCOS surgery using 3D laparoscopy to remove the abnormal testosterone secreting testicular tissues within the ovaries. And after that, if you have a fallopian tube disorder, then we will have to use laparoscopy to treat that as well. Or if you have a uterine malformation, then we will need to use hysteroscopy to do a uterine corrective surgery. At the end of the day, this complication of ectopic pregnancy, whether it be infertility or recurrent miscarriage, all can be prevented. And your PCOS actually can be treated at a one-time effective surgery. You do not need medication to depend on, and you can experience healthy ovulation, healthy pregnancies with no complication. So do get in touch with us and get your diagnosis as soon as you can, preferably before pregnancy, so that you can have the most comfortable, smooth pregnancy journey. So get in touch with us via the website, set up a consultation today, and let's see how we can help you on your pregnancy journey.